So for this, we're going to be setting up an IV line. First thing you want to do when a paramedic hands you the medication, or the IV in this case, is to dice your drug. You're going to start with D, make sure that it's normal saline, or in this case, 0.9% sodium chloride. You're going to check the integrity of the packaging that it's in, not only the packaging, but also the actual container itself. You're going to check the clarity of it. In this case, we're looking for it to be clear with no particles or anything floating around inside the container. And you're also going to check the expiration date. Expiration date appears in the top corner. This says October 13th. And same thing with the IV tubing. In this case, the expiration down is down on the bottom, November of 2014. So when you go to open it, you're going to take the two tabs here where the perforation is and simply just tear downward. Same thing with the IV tubing, little line, just pull down. Remember, you want to keep aseptic techniques, so you're going to keep everything clear from hitting the ground or making contact with anything. With the tubing, personally I like to set up the lock up towards the top. That way it's easy to get to. I personally shut it down prior to spiking the bag. You remove the two stoppers, one on the IV bag, the other one on the actual line itself, the tubing. And then you're just going to insert the tubing with a twisting motion. You're going to prime the chamber by squeezing. And then once you do that, keep this up in the air. Release the lock, and it will flush out all the air in the tubing. Once you've gotten all the air out, shut it down, and your line is ready to go for the paramedic.
Since you're setting up the IV bag and flushing the air out of the tubing, the paramedic can go ahead and start setting up the IV. They're going to begin by applying a tourniquet to the patient's upper arm, and then they're going to locate the actual site they want to make the stick. Once that's been done, they'll go ahead and prep the site with an alcohol prep to reduce the risk of infection, and then they'll go ahead and take the IV catheter and make the stick. So the way the IV works is there's a little needle that escorts this flexible catheter into the vein. We know we're in the vein because blood will come up in that flash chamber. At this point, the needle can be withdrawn from the catheter, and the paramedic will ask you to hand him or her the tubing so they can plug it into the IV catheter. Now you're going to open the IV wide open to flush the blood out of the tubing and to get that IV going. There's a couple of different ways to secure the IV. In this case, they're using one clear bandage over the top, and then they're going to go ahead and put a loop in the IV tubing and secure that in place with a piece of tape. You have to remember that the IV is gravity dependent. It's only going to flow if you keep it higher than the injection site on the patient's arm.